Well, good afternoon, everybody. This is Dr. Mike Talbot. I'm the CEO and founder of UK Mediation. It's 12 noon on Friday, 12th of April, and you're very welcome to join us for our webinar this afternoon, talking about mediation within the emergency services. Just a very quick word about me and the company first. So we are just about celebrating our 20th anniversary in UK Mediation. I started it 20 years ago, and we have been doing mediation training and mediation services in all sorts of areas during that time, working with neighbourhood disputes, workplace disputes, commercial matters, working with boards of directors, charities. And today, one of the areas we do a lot of work with is within the emergency services. So working with police, fire and ambulance in order to look at repairing and strengthening relationships between people who work in these very important areas. So this afternoon, I will be talking for around about 40 minutes. And I'm going to be talking about the following issues in connection with workplace mediation. What's it all about? So we need to think about how we use mediation in workplaces, of which the emergency services are an example. What it is, what it means, how it happens, and three unique factors that cause conflict in the emergency services. So there are many different workplaces around. The emergency services have their own particular challenges. And I'll be mentioning a few of the factors that impact on conflict within this particular setting. I've got some case studies for you. So we will present some highly anonymised, unrecognisable case studies, just to talk about the kind of examples of work that we have done within the emergency services. Some of the many cases that we've come across in this particular area. And then about how workplace mediation gets provided. So if you're from an HR function, or if you're a manager from the emergency services, or if you're a potential participant within mediation, there's a little bit of flesh on the bones there about how workplace mediation actually gets provided, how it would work, the nuts and bolts of the process itself, and then a little bit on the end about how we can help. So let's launch in and talk about what we're talking about. So mediation, bit of an unfortunate word. It looks a bit like meditation, and we get it all the time. So when people see this word, they think, okay, it's some kind of a soft option, something to do with counselling, it may be to do with hugging trees. It's an unfortunate word. What it means is somebody who's impartial, brings about a better and more constructive conversation between people. So a mediator who's able to not arbitrate or determine people's issues, not make judgments about who's right or wrong, not provide legal advice or HR advice, not to run any formal process. It's a pre-formal or informal way of bringing about a better and more constructive conversation, which should preclude any need for formal action. So you have your grievance and disciplinary processes, you have your capability processes. We have this additional workplace mediation process, which if it's successful, it means you don't need to use any of the above. Things are patched up, matters are resolved in such a way that there's no need for any formal action. What we find is that this really transforms people's working relationship. So it tends to strengthen that relationship. When we get people talking and having this thorough and more constructive conversation that possibly they've ever had, it can really put a buttress against the relationship and protect it against any future challenges. So we find that the relationship is not only repaired and the immediate disputes not only resolved, but also it strengthens the relationship ready for any future challenges and transforms that relationship into something that's rather stronger. But it has to be voluntary. So we have to be sure that people taking part in mediation in any setting, and not least in the emergency services, there mustn't be a sense in which people have been told you've got to do it. If you're told you've got to do it, we tend to push back. And in the same way as when I go into the computer shop and buy myself a laptop, and there's a lovely salesperson wants to sell me some antivirus software that I don't want, and an extended warranty that I really don't want, and a laptop bag that I don't need, the harder they push, the more I push back. And I think the same is true with many aspects of life, that if somebody wants to make you do something against your will, you're going to push back quite hard. And what we have found is if the process is not voluntary, people are going to turn up, arms folded, tight-lipped, and really not participate in any useful degree. So it has to be voluntary, it has to be confidential. we're expecting some kind of a different conversation here, maybe a better conversation than parties have ever had around their working relationship. So no records are retained. We encourage people to speak openly, and so the disclosures are minimal. There would need to be disclosures around certain things that could potentially put people at risk. So if there was any hint of anything alluding to prevention of terrorism or child protection or laundering the proceeds of crime or fraud, then we would need to make disclosures just to ensure that the law is being followed, nobody's been put at risk and nobody's been put in jeopardy by the process. But other than that, the process is private. That means that you can speak openly and honestly. That means you can dig deep and say what you really think about your colleague. And that means that the mediator is not going to pass things back to the organisation. The parties can feel safe to really express their thoughts and feelings in a way that perhaps they've never done before. And the third thing here is about it being future focused. So in a lot of the formal processes that I've just mentioned, what happens is that we get records retained, we have note taking, you may have witness statements, you might have parties being accompanied by a colleague or a trades union rep. In the case of police, the Police Federation rep or the FBU rep. In this process of mediation, it's future focused, there's no accompaniment, we're not talking about blame, we're not talking about supporting people's stories about the fact it's the other guy's fault. We're looking at the future, we're looking at focusing on what you're going to do differently starting tomorrow. So the atmosphere of the mediation is all about the parties' shared responsibility to make things better, rather than looking backwards and saying who has made it bad, who has got the greatest contribution to making this situation as bad as it is. Not interested in that, we do future focus. So when you look at that list, the essential elements of workplace mediation, voluntariness, confidentiality and future focus, I think that really defines what we're talking about and that makes mediation different to other processes. If it's not voluntary or private or future focused, it's probably not mediation. So there we have sort of the bare bones of the process. That's the animal we're talking about. Let's go zoom in a little bit now and talk about some unique factors that can lead to or contribute to or exacerbate conflict within the emergency services. And I think one of the first and most obvious things is the high stakes of the job. You know, personnel within the emergency services are making life and death decisions. There are situations for police, fire and ambulance where your decision could lead to somebody being you know, their safety being preserved or actually their safety being put in jeopardy. These are you know, serious issues which indicate the high stakes of the job of working in these particular settings. Careers are short as well, so you know, 30 years in the police is typical. Progression is highly rewarded. There are very ambitious members of the emergency services, and that's a great thing, you know. So within police, fire and ambulance, there is going to be some competitiveness in a promotion race. I think this influences how people get on. So where there is competition for promotion, where there are situations to do with seniority and how people manage and the way in which we communicate when we're in management or senior posts, I think these add to the stakes of the job. So these are, you know, particular factors, not just of the emergency services, it applies to other workplaces too, but I think it's particularly in evidence in our experience within police, fire and ambulance. And I think the other thing about the high stakes of the job is that you're under quite a lot of pressure from outside. The public are much more inclined now to complain against emergency services personnel. There seems to be something in our culture now which means that, you know, figures of authority are not quite as deferred to or respected or highly regarded as they used to be. There seems to be a strong tendency for people to complain about the actions of members of the emergency services. And I think this puts added pressures from the outside onto what you do within police, fire and ambulance. Second thing is about just the inherent pressure within the job due to lack of resources. We all know that there's a shortage of bobbies on the beat. We have fewer hospital beds for emergency cases. We've got backlogs. You know, ambulances queuing up outside A&E. It's a difficult setting. You know, response times are now scrutinised far more critically than ever. It used to be, you know, 9-10 years ago, ambulances would return to the waiting station at the hospital. These days, you wait in Sainsbury's car park in order to keep your response time down to the target number of minutes. This lack of resource means that there's a pressure on the services. And the other one for fire is about the prevalence of retained fire stations now, so the on-call fire stations. So now the firefighters are called in when needed. So firefighters have their own jobs. They've got a bleeper, and they're called when they're needed, and they have to remain within a certain number of minutes of the station, and if they're going to be further than that number of minutes from the station, they have to let the controller know, so that they're not going to be available for a shift. So I think the shortage of resources puts pressure on personnel within the emergency services. Fewer personnel, response time has been scrutinised, and things like retained fire stations. That means it's just harder to, it's a more difficult job due to the lack of resource. And the last thing I think, just to mention here in terms of the peculiarities of the emergency services, is about stress. Unsociable hours, working over your weekends, working late into the night, very early starts. You're coming to work tired. There's quite a bit of data on this now from the CIPD, from the Health and Safety Institute, about emergency services personnel are coming into work feeling tired, and inevitably feeling extremely tired by the end of your shift. It's a more dangerous job. We are hearing almost every day in the news now, particularly in certain towns, about the increase in violent crime, and especially the increase in knife crime. Just a few figures that we've pulled up here for this webinar is that the job is really more dangerous. We've got a 19% year-by-year increase in violent crime and a 12% annual increase in knife crime. That was up until September last year, and judging by the news reports, it's gone up even more since then. And it's not just police officers putting themselves in the firing line. We hear about ambulance personnel and fire personnel being attacked when they go on emergency response, and it's a dangerous job, it's a stressful job, it's something that's quite a difficult thing to bear. So Mind, the mental health charity, has in fact found that 9 out of 10 emergency services staff have experienced some stress, low mood and poor mental health at some time in their career. And what we find is that, especially to do with exposure to critical incidents where there is death or near death or serious injury, these things can be very traumatizing. And increasingly, the actions of emergency services personnel are going to be subject to investigation. So most things that result in loss of life or serious injury where emergency services personnel have been present or have been called, these will be subject to an investigation. It makes it quite a stressful job. So there is a high incidence of mental health, there's a high increase in especially the violent crime rate, and there's this likelihood of investigations, especially in critical incidents where there's going to be an accompanying traumatic response on behalf of the personnel as well. These things make it difficult. These things make it more likely that you're going to encounter conflict within the emergency services. So that's where we are. So the next bit I said I was going to talk about was a couple of case studies. Now clearly with the confidentiality of mediation we can't name names and I can't give too many details about where cases have come from, so I'm going to be a little bit cagey about what I say here. Just to give some examples of case studies which could have come from any of the 3 emergency services, but one example is where staff are asked to work on their rest days, where staff were expected to come in and work on the days when they're not, when they're supposed to have their feet up and being at home. This causes a lot of problems. So there's a mediation case that we have done where this happened and where there was quite a bit of resentment, which led to a potential discrimination claim, where some members of personnel felt that they were being asked more than others to come in on their rest days. It was something to do with gender, it was something to do with marital status. And this gave rise to factionalism within the team, within a particular shift within this particular emergency service. So this began to be acted out in terms of very poor communication between parties at work, from small things like parties not speaking to each other, not making each other cups of tea, up to large things like allegations of actually being set up, of locker keys going missing, of offices being rearranged in order to bring together the members of one particular faction. And all of these allegations were about to be subject to a formal process within this particular emergency service, and they got mediation involved. So we actually did a team mediation here. There was around 6 or 7 people involved, some of whom felt they were being asked to come in rather more than the others on the rest days. So it was rather like an us and them situation. So in this case study, there were 2 mediators. 2 mediators went in, met everybody individually, spoke with parties in this private setting within mediation, found out what their perceptions were of this conflict, where it had come from, how it had been acted out. It had been going on for about 4 or 5 months. And then we got everybody together in a team setting for what turned out to be around about 4.5, 5 hours, quite an intense setting. And a lot of past resentments came up in terms of these issues to do with rest days. That some people felt that because they lived nearer to the place of work and because they were male or female, married or unmarried, they were being asked more or less to come in on their rest days. And there were, in some people's eyes, some fairly strong grounds for a discrimination claim there. We figured it out. We made some resolutions. They got some of their own agreements put together. And in mediation, it's very important that the parties themselves come up with the agreements. It's not for the mediators to start waving the terms and conditions around or waving the code of practice around. Parties attend on their own. They speak for themselves. It's very much about perceptions. And there was a lot of give and take in that mediation, a lot of acceptance that things had not been working in the way that they should. And there was a good future-focused plan put in place. What we do with mediation is, having met parties privately, having got them together and made an agreement, we get their consent as to whether they want to feed that agreement back to the organisation. In this case, they did want to feed back a rather abbreviated version of it with some of the more personal stuff taken out. And then what we do as part of our service is we follow up after 4 or 5 weeks to check with the parties whether things are working. In this case, they got round about 9 or 10 bullet points of agreement, and 8 or 9 of them were working. So we had another brief intervention with the parties just to check that the agreement points that hadn't held up quite so well over that time, to check that they weren't going to get in the way of the restoration of the working relationships. And having attended to that, the long-term follow-up was actually very successful. So a success story. And in case you're curious about mediation and the success rate, it works from around about 80% of the time. So provided cases are correctly selected for mediation, this would have been one of the 80% of cases, 4 out of 5 cases, that do lead to a successful resolution. I'll say a little bit more about successful resolution in a moment. Second case study, just very briefly, is around competing for promotion. So there was a scaling down. I mentioned about shortage of resources earlier. And there was a scaling down of numbers within a particular location within the emergency services, I don't need to say which, in which several people went for a more senior post. So there were 3 people who used to work together on the same level who all went for the same post, and there was only 1 post. So one of the people got it, and inevitably this sort of shook up the dynamics, the interpersonal dynamics between the 3 parties. There were some grumbles about the promotion process, and there had been even some allegations of favouritism, that they reckoned that the person that got the senior role, that he or she had been favoured by senior management, which was strongly resisted, but there was still this feeling that it wasn't an entirely fair process. So it's a really good example of where they could have taken that formal and had some, it would have been based on a grievance, formal grievance, to look at the recruitment process. But instead they decided to pay more attention to the working relationships and how are we going to get on, given that this is the situation, how are we going to get on and actually work well together. The one in particular of the people who had failed to get the promotion was a bit unhappy about how the person who did get the promotion was talking to them, that he or she was rather lording it over them, as they put it, and throwing their weight around and saying things are going to be a bit different around here, and they weren't too chuffed about that. So again, 3 people in this case, and we had a 3-way mediation, met everybody individually, heard from them. In this case, we had to be really clear that it wasn't to be done with representatives. There was a little bit of negotiation up front about not bringing along the Police Federation reps, about not coming along and waiving the code of practice at the mediator. But to say, we can't investigate the recruitment process. What we can look at is how the 3 of you are going to get on, given that this is the situation you find yourselves in. So quite a successful 3-way mediation. And there was a joint resolution to actually take a look at the recruitment process, including the person who'd got the promotion. They wanted this to be completely transparent and out in the open. So there was one of the resolutions was that they jointly approach the powers that be in order to get some exposure about how the recruitment process had run, because the promoted person was quite happy that it was done properly and that really wanted to persuade and convince the other parties that that was the case, and the other parties obviously would have their minds put at rest as well, knowing that that was the case. And thirdly and lastly, too much contact when on sick leave. This was a case where somebody had been involved in a traumatic incident, as I mentioned earlier, and it was quite an unpleasant incident involving a death and some of the near deaths, and they had gone off quite understandably with a sort of a traumatic stress response, and felt that they were being hassled to get back to work. So off they were, and the shift was very short, and the manager of that shift was quite keen for the person to get back to work. He or she was keen to say, when they were spoken to by the mediators, they're saying, look, I'm only trying to let them know, that we care about them, we want them back, we want them to be okay. But this was experienced by the person who was on sick leave as being harangued to get back before he or she felt quite ready to get back. And the person who was off felt as if their trauma was being minimised. They felt as if the service wasn't taking them seriously, that it was, they were swinging the lead, really, which when we met the parties and when the parties met each other, it clearly wasn't the case. And I think it was a good opportunity of what we can do in mediation, which is to let other people know the impact of their words and behaviours on you. So the parties in this case, it was just a two-party case, this one. It was the person who'd been off and the manager who had allegedly been contacting them rather too much or more than they wanted. So for those two parties, it was a good way to sit down and have a thorough exchange of views about how your behaviours and words are impacting me and how your behaviours and words are impacting me. It was quite an emotional session, and the person who'd been off was clearly in a bad place and was clearly showing a lot of the symptoms of trauma. And while it was a difficult thing for them to do, we had to do it off-site, incidentally. We had to go into a hired training room that was away from the place of work because the person who was traumatised couldn't bear to come back on site. But we did the mediation there. And there was a plan put in place regarding contact, regarding return to work, regarding the relationship between the manager and the person. It was a very good outcome, a very successful one, and I think it probably prevented and mitigated that person being off even longer on sick leave. And as I understand it, they had a phased return to work, and although they went back to a slightly different role, they could get back into employment as it happened before their 6 months was up. So just a few anecdotal case examples there about the kind of things that can arise either when you've got these shortage of resources, people are being asked to come in on their rest days, where you've got things that arise from restructure and promotion, and the third one is about things that can arise around the very nature of the job that you do in emergency services that does involve trauma. It can involve people having, quite profound psychological reactions to some of the stuff they have to see, and about how that can lead to conflict itself. So just a few examples. So let's talk about some nuts and bolts of workplace mediation and about how it gets provided. So you may be thinking, if you're from an HR function, I'm just looking at who's with us this afternoon. We have some HR contacts, we've got some managers from the emergency services, we've got some officers and staff members from emergency services as well. Great to have you joining us, by the way. And you may be wondering how we actually do this thing. What do we do to provide workplace mediation? Well, essentially there's two ways of doing it. So what you might decide is that you have a need for some internal workplace mediators, and most services are big enough that this could work. So we generally say, as a rule of thumb, if you've got 500 plus employees within a particular region or a service or a district or constabulary or sort of a county, if it's defined by county, as long as you've got 500 plus employees, you might have internal workplace mediators. The reason for the numbers argument is that it's best that the parties who are being mediated don't know very well the mediator. If you're in a small organisation, everybody knows everybody. And it makes it a bit tricky because you may have socialised with parties, you may know their kids, you may know where they live, you might have shared a lift with them, you may go to lunch with them. That makes it very tricky for you to be impartial and removed from the situation. So in larger organisations, those phenomena are less likely to occur. You may be able to find somebody who doesn't really know the parties that are being mediated. In that case, we can have a mediator panel. So we would set up a number of mediators who would form a panel, and there would be an internal case manager or a case coordinator and they would take referrals from either through HR or from local managers or team leaders, or in some cases self-referrals where parties themselves can put their hands up and say, oh yeah, I need mediation. So in that case, the internal mediators might be doing 5 or 6 cases a year each. That would be typical. And what we recommend, especially for starting out mediators, is that you work in pairs. So you've got your internal panel of mediators. Everything's coordinated internally so that people can ring the mediation hotline internally and alert the case coordinator, who lines up a couple of mediators, and the mediators see the parties separately and then bring them together for a meeting, ideally off-site. As I mentioned earlier about that case, it was far preferable that it was done away from parties' normal workplace. And the working in pairs thing is a very strong way to, especially like I say for beginning mediators, very strong way to embed people's skills. It's a very thorough way of doing mediation, and particularly where there are instances where there are allegations of discrimination or people being treated differently on the basis of their gender or sexuality or age or educational background. If you have a pair of mediators who are conspicuously different themselves, it can be a really good way to engender that sense of inclusion, responding to diversity, ensuring that everybody taking part in the mediation feels that there's somebody there for them and who can take account of their interests and their imperatives. So working in pairs internally, half a dozen cases a year, that's one way to do it. Alternatively, what a lot of police, fire and ambulance services do is they bring in external mediators. So we have the sort of second part of the model, which would be bringing in mediators from us or another provider if you prefer. Mediators from outside who would probably be freelancers who work across several organisations. So here at UK Mediation we have a number of retained mediators, they're the busy ones. We also have a panel of affiliate mediators who are freelancers. They might do work for other people, they do a lot of work for us. They tend to be more experienced, so these would be people who do mediation for a profession. So by way of comparison to your internal mediators who may have all sorts of roles within the organisation, if you buy a mediator in from the outside, they're going to be a professional mediator who does this 9 to 5. Tend to be more experienced and they're doing a large number of cases a year. And because of the greater level of experience, they would often be working alone, so they wouldn't necessarily be working in pairs in the way that I described earlier. So they'd be working alone. So this is a pay-as-you-go model, so you only pay the mediator when you need them. They come in from outside. We have case managers here. Any other reputable mediation provider would also have case managers, somebody you can speak to ensure that the case you've got is suitable for mediation. And then to set the whole process up so the mediator arrives with a room set up, meets the parties for the first time, speaks to them privately. There is that greater sense of trust because the parties don't know the mediators, never met them before, never going to see them again. So the parties can feel as if the confidentiality is stronger, it's going to hold up more robustly, and they can have a greater level of confidence that nothing's going to get fed back to the organisation. We have to do some convincing of that every time that our mediators go into organisations and give a written assurance and look you in the eye, fairly sincere verbal assurance that this is all private, nothing's going to get fed back. The parties often need a little bit of persuading or reassurance that that's the case. But when you've got external workplace mediators as opposed to the internal panel, I think you're starting from a good place there. They believe it more readily that it is private, you're not going to feed things back. So we could compare these two models. The internal workplace mediators, where you've got your own panel. The benefits are that you're training up officers within your own service. They speak the language, they understand the culture, they know the sorts of pressures that are on people. So in that sense, they can feel more enculturated into the same sort of milieu as the parties that you're doing the mediation with. And of course, it's less expensive once you've paid for your training and you've got your trained mediators ready and willing to do cases. You know, there's no more expense other than the time it takes to do the mediation. And typically, it would be a working day to do a two-party mediation case. A bit longer if you've got more parties, but pretty well 7 or 8 hours to do a one-on-one mediation case where you've got a morning of private sessions and an afternoon with joint sessions. This might be done at the station where you work, police, fire, ambulance. You might take it off-site. And then the other model was the external workplace mediators, where you know, there's the extra layer of confidentiality, the extra trust for the impartiality, and the extra assurances, you know, that nothing's going to get back to the organisation and that people can speak openly and honestly. What we do is that we can provide those external mediators. Case takes place in a single day, can be two-party disputes to whole team mediation. So our record is 38 people, no kidding. Most commonly it's 2 people. It's not unusual that we work with 3s and 4s. So disputes involving 3 or 4 people, perfectly feasible for the mediation model I'm talking about. We can also train you up to accredited mediator status with a whole support package and setup, so everything you need to hit the ground running after the training. So if you choose to have the internal mediator model, it's the second one of those things where we come and train you. And what we do is we don't train you and leave you. We offer case supervision and consultative support for individuals or groups. So once you're trained, once you start to use your skills, if you train with us, you've got a telephone hotline. We can help you as you get your first cases and start to put your skills into practice. Okay, so just a very short thing there. I try not to be too salesy with you. Just to say that we can do either mediators that we send in for you, or we can train you to do it yourselves. There's the sales pitch. Okay, so we move on to any questions. So I see there's a couple of questions coming in. If you're watching this live, then you'll see the chat box there, the chat box where you can ask us questions or make some comments. You're very welcome to do so. And I think we've got one question by email. And the question by email is coming from Marge. Marge, thanks very much for your question. You're talking about this thing about on-site or off-site mediation. In terms of doing it in the station or going off-site, well, I think in a word, Marge, you know, you're better off going off-site if you can. I appreciate that resources are scarce and you may not have a lot of empty rooms kicking around. There's a lot of demand for rooms within most stations, but if you can possibly get a venue off-site, it's just much better. It gets people away from prying eyes, away from your normal workplace. You can either hire conference rooms in hotels or use a training suite away from the main station, which is what I've done and our mediators have done in a number of police stations, for example. There's often training rooms tagged onto the end of HR or occupational health. So it's just a sense of being away from the normal working environment. It means that it feels different. It gives you that air of privacy. It feels like it's something serious and deliberate, something that you've chosen to do away from your normal working day. So thanks very much for that. So another question here from Paul. Thanks very much. Paul is saying it's an interesting webinar. Thank you. Paul's wondering if the techniques that we've described can be used for other areas like complaints from members of the public. Absolutely. So there's a slight sort of variation to what we call mediation, is called restorative justice, and this is something very many more similarities to mediation than differences. But what restorative justice is a way to get together 2 people who are in dispute, usually around something that one side is complaining about. So where there have been, for example, complaints against emergency personnel, police, fire, ambulance, what we're able to do is to use the mediation techniques to set up a meeting between the complainant and the person complained against, to allow everybody to air their views, usually in a group setting when we use the restorative justice techniques, for both sides to say, both sides I mean, not just the complainant but the respondent as well, to say how they've been impacted by the situation, and for both sides to negotiate about what they feel needs to happen, which can include an apology, an explanation, some kind of reparation, putting things right, an assurance that what happened isn't going to happen to anybody else. It's very close to mediation, but we call it restorative justice conferencing, RJ conferencing. It's a technique we've used with police, fire and ambulance and with military as well, where there have been complaints from the public against the emergency services personnel. Very much like mediation, excellent way to deal with complaints, very quick, very effective, and far more productive than the formal processes where you get a standard letter saying we apologise. So yeah, thanks for that question, Paul. And the short answer is yes, indeed, these techniques can be used for things like complaints from members of the public. Another one here from Debbie, especially within emergency services, there is this hierarchy, and I think this is what's leading to your question, Debbie. You're saying about how do you handle a workplace dispute when there's a massive power imbalance, for example, different ranks within a police constabulary. Well, it's an interesting one, Debbie, because within emergency services there is a need some of the time, a lot of the time perhaps, for a command and control approach to management. You know, and in critical situations, if somebody tells you to climb into a burning building, or to, you know, in the extreme case in the police services, you know, to shoot a hostage taker in the leg in order to disable him or her and save somebody's life, then you do it. We don't turn around and say, yeah, I'll explore that instruction. And there is a need for hierarchy. There is a need for that command and control structure. In the terms of workplace relationships that have broken down, what we encourage, conversely, is that everybody comes into the process in the manner of fellow employees of the same organisation. So even though it's your chief inspector, and even though you're a new sergeant, you come in there. What we recommend with some of the services we've worked with is you take off the epaulets, you take off the tie, you come in shirt sleeves. We have an informal setting, and it's a place to have a conversation about how the two of you relate. It's about your interpersonal dynamics more than the hierarchy or control structure of the organisation. And in spite of the hierarchy, what we find is when we do that, and when the mediator is quite insistent around the informality of the process and around the equality of the parties who are taking part, it can be very, very successful. So I think the hierarchy is there for a reason, in short. I think when we're looking at mediation, I think we need to put aside the power imbalance. We need to put aside the hierarchy as far as people can. We even encourage the use of first names, and to have people negotiate as fellow employees of the same organisation, and it can be very, very effective. A message here from John Owen, thanks very much, who says that early intervention is another alternative to restorative justice. Absolutely, John, I wouldn't disagree with that at all. So the early intervention, again, using some of the mediation techniques, looking at an informal, supportive process, future-focused process, such that we don't need the restorative justice. So we can intervene at the point of conflict, and then there is no need to be thinking about repairing a situation, because you're actually preventing the situation from getting to the point of a dispute, and to the point of where such an intervention would be needed. So yes, thanks for that, John. I absolutely agree. Early intervention, another alternative to RJ. Fantastic. So thanks for your questions. One or two more coming in there, but we can pick those up afterwards. While I take a minute to say, within my 40-minute window, we've got some webinars coming up. You can register for any of our other webinars. Go to our website and find /webinars. You can sign up for them as well. A couple coming up, we're talking about the psychology of conflict. So this is my stuff, my doctoral work around sort of the underlying psychological roots of conflict, why we get into conflict, why we get stuck there, why we need things like mediation, and why mediation works. So some of the unique offering to the field that UK Mediation has had over the last 20 years is we're going a bit deeper. We're saying, look, mediation's all we do. We need to know how it works. We want to understand what's under the bonnet. And we've done a lot of research into what's going on in terms of the underlying processes, what happens when we get stuck into conflict and disputes, and what we need in order to move on. So you'll be hearing about that in some more detail on Friday 10th of May, if you care to join us. And we're doing some stuff on medical mediation Friday 7th of June. This is a very big area for us. We do a lot of work with NHS trusts, especially where there are fallouts between patients, carers, parents and the medical professionals, often around disagreements, around critical decisions to do with withdrawal of care, to do with palliative care decisions, something that we do a great deal of. We'll be looking at in some more detail on Friday 7th of June. So do join us for that one. And another one in July on mediation and new technology. Not only the use of new technology within mediation, but how new technology contributes to conflict. So we all know about the negativity and bitching that can go on Facebook and Instagram, etc., and how that can actually exacerbate conflict, but also how we might use new technology to advantage in terms of conflict resolution. I also want to tell you about our mediation showcases, but I'm just slightly distracted by another question, so I will mention this one. It's from Richard Sharrett. Thank you very much, Richard. In our experience, do the emergency services have the ability to choose the mediation company, or is it a case of tendering for a contract? Great question. In our case, we have a lot of ad hoc arrangements with most of the supply we have into the emergency services, Richard, and we also have service level agreements which have been subject to a tendering process. So a bit of both really is my sitting on the fence answer, Richard. So we do have ad hoc contacts from emergency services on a one-off basis. So XYZ police service or XYZ ambulance service will contact us for a one-off intervention for us to provide a mediator for a specific case. And in some other cases, we have an SLA, service level agreement, where we provide a certain number of cases per year. So they buy a season ticket in effect, and then we will do their 6 or 8 cases or 10 cases in that year. So I'm all in favour of tendering. I think it's important that we spend public money wisely. We very much welcome the opportunity to tender for contracts just to be sure that that money has been spent on the best provider who's usually us. So thanks for that, Richard. Our workplace mediation showcases. It's fine talking about mediation. I'm very happy to talk about mediation, tell you about what it's all about with a few slides, a few examples as we've done this afternoon, but there is no substitute for seeing it happen live. So that's what we do. We are doing our mediation showcases. Showcase, it's an opportunity for you to come along and see what mediation actually looks like. And the background picture there on that slide is actually from one of our mediation showcases that took place in London recently. And what you'll see there are 2 parties in dispute, and the mediator sat there by the flip chart who is actually mediating the case in front of your very eyes. So it's a chance to come along and see mediation in action. We do a stop-start with the action, a bit like forum theatre. So we can narrate what's going on, we can give you the story about the steps and stages of the mediation process. It's a chance for you to ask questions and actually see what happens within a real live mediation case, well, real live simulated mediation case. We're doing that in Manchester on the 16th of May. We're going down south a week or so after that, London on the 24th of May. Again, if you want some details, take a look at the website, /events. We'd be delighted if you could join us for one of our mediation showcases. There we are. We like to keep in touch with you. I like to try and keep within my 40 minutes, and I've done 42 today. Like and subscribe us on YouTube. Follow us on Twitter. You can connect with us in 2 ways. There's LinkedIn for UK Mediation, and there's my personal LinkedIn for Dr. Mike Tolbert. Take a look at our Facebook, like and share. The address is on there. Do keep in touch. You can sign up for a newsletter. Best idea is to follow us on Twitter, really. You'll get to hear about everything that's going on. We do announcements of showcases and webinars, etc. So it'd be great for you to keep in touch. We like to help you out. We like you to know what mediation can offer. We like people in the emergency services to make the best use of this that they can. So I hope that's helpful for you today to hear about the use of mediation within the emergency services. A few clues there about how it works, how it can be provided, and what we can offer. Stay in touch. Thanks very much for coming along today. Have a good weekend, and bye for now.